Hi, everyone. Welcome to the third series or third session of our series, Tools for Parenting a Child with FASD. Today, we are going to be focusing on interventions for teens. I am Kallio Hunnicutt-Ferguson. I'm a psychologist and prevention specialist with Emory University Center for Maternal Substance Abuse and Child Development. So just to acknowledge some of the sources of funding of our clinic and program, and just to say that I have no conflicts of interest to report. And I wanted to actually start us out with a short clip from a documentary that was created about teens growing up with FASD. I thought it could be a good introduction to this topic, which can be sometimes a challenging topic. So I'm going to stop sharing my screen and share the video clip. Hopefully everyone can hear this.
Last week, I got in a fight with someone. He hit me first, so I hit him back.
The fact that I got as far as I have without having a breakdown at any point, a really big one, I got really lucky.
Why are you upset?
Go away! When my birth mother drank when I was in her womb, that it affected parts of my brain and all that.
She said that my mom drank alcohol and it damaged my brain.
Usually had to be physically restrained somewhere along the line as he got older because he'd just tear up everything. We were afraid that he was going to hurt somebody as he got older, but you can't let him see the fear because that just makes him stronger and more determined that he's going to do something.
Do you get into trouble a lot?
Sometimes. They arrest me, take me to jail, 3 days.
I worry about Allison as she gets older on her own. Who's gonna be there to tell her right from wrong?
Everything was stacked against this child before she was even born. And the fact that she could scream at 3 o'clock in the morning was a good thing.
I'm sure that something like this can drive a wedge in between a couple, but we have chosen to use this to strengthen us, and it has.
All right. So again, I think that's just to show a little brief introduction to the kind of different ways that prenatal alcohol exposure can impact teens. And this documentary, if you're interested, we're not affiliated with this group, but goes into much more in depth about how follows these teens who have been impacted by prenatal alcohol exposure. So we know that the transition from childhood to teenager can present some unique challenges for both the caregiver and the teenager. All teenagers want independence and freedom to make decisions. And as a parent or a caregiver of a teenager with FASD, there often need to be ways that you can find to safely respect these desires while also staying in tune with the teen's unique strengths and challenges. In addition, the teenage years become an important time to look for what we call secondary impacts of FASD. as they can often emerge or even worsen during this important developmental time. So secondary impacts are those that may not be due directly to the neurobiological impact of prenatal alcohol exposure, like some of the cognitive and self-regulation deficits are, but nevertheless are seen in higher frequency in those with FASD diagnoses. And these secondary impacts are sometimes due to a poor fit between the person's needs, their level of functioning, and the environment. So some examples of some of those secondary impacts can be school disruption, continued school disruption, mental health problems, substance use problems, poor self-esteem, self-harming behaviors like cutting or burning or headbanging, high-risk sexual behaviors, as well as criminal justice involvement. Other common presenting problems during this developmental period include increased truancy, increased problems linking cause and effect when, again, that might be, those skills might be expected, at least based on the person's age. Increased problems linking or problems managing time and money, difficulty showing remorse or taking responsibility for actions. They may be seen to say that they understand instructions, but then have difficulty carrying them out. They may not have understood a portion of the directions or may have gotten lost, but feel uncomfortable asking for help. And because of these various emerging or worsening problems, parents and caregivers may find it challenging to provide adequate monitoring in order to keep their adolescent and even adult children, as well as the surrounding community, safe. And as we'll discuss a bit more in the intervention section, treatment approaches aimed at decreasing participation in some of these high-risk activities might focus on enhancing skills that target some of those underlying difficulties that can include improving decision-making and problem-solving skills, and improving behavioral regulation skills, as well as better equipping parents to supervise their children's whereabouts, activities, and peer associations. So this diagram shows an example of the difference in numerical age and actual developmental milestones of an 18-year-old with FASD. This, of course, doesn't apply to every single 18-year-old with FASD, but just as an example of some of the discrepancies between numerical age and developmental age. So parents and caregivers often have expectations for children based on their age. So for example, Katie should be able to walk to school by herself because she's old enough. However, this kind of thinking usually assumes that the child is meeting their developmental milestones, whereas research has shown that children and teenagers with FASD are usually developmentally younger than their peers in most areas. We must remember, of course, that each child and teen is unique. And so we really need to look at that person's unique developmental stage versus their chronological age. So for example, in this diagram, for an 18-year-old, their reading ability may be more like that of a 16-year-old. Their comprehension, social maturity, and social skills may be more like that of a 6 or 7-year-old. Their living skills may be more commensurate with those of an 11-year-old. And interestingly, though, a common pattern we see is at least average language skills, and shown here, expressive language skills that are really a strength for this person, more like a 20-year-old. So again, just to repeat that it's important with teens with FASD to really look at where they are developmentally versus their actual physical or chronological age. So I'll talk more specifically now about some of the areas that are important to target in teens with FASD. And then the last section, we'll talk about some of the different interventions that are available targeting these areas. But we've we've discussed that school disruption is one significant area impacted for teens with FASD. So we see often a continuation or worsening or maybe even just a shift in some of the earlier difficulties we might see with school performance in younger children with FASD. Those problems don't just go away when these children enter their teen years. But school can really be challenging for any teenager. But for those with FASD, there often are, during this phase in general for teens, there are often higher expectations on students and less support available. And so that can provide or present some unique challenges for those with FASD. Teens with an FASD diagnosis may not want to ask for extra help because they don't want to appear different from other children. And without that help, they may end up feeling frustrated or fall behind with their schoolwork or their school performance. And this, along with some of the other challenges, can lead to school disruption. Mental health problems are one of the most prevalent adverse outcomes associated with FASD, with an estimated 90% of this population experiencing mental health challenges over their lifetimes. And these problems are evident even among individuals with relatively low levels of prenatal alcohol exposure. And they can range in severity, but can range from emotional adjustment and attachment issues to more complex psychiatric comorbidities in adulthood. This chart is some data from our group in particular, but these results have been replicated and seen in other samples as well. And in our data, we saw that those who were exposed to alcohol prenatally showed significantly higher rates of nearly all the diagnoses that we examined. That included ADHD, depression, bipolar disorder, and anxiety. And psychosis was the exception. So we didn't see higher levels of psychosis in this in the population of those exposed to alcohol prenatally compared to the control condition. Suicide risk is another significant negative outcome for teens with FASD. So they have double the risk of suicidal ideation compared to their peers in the general population, with as many as 35% of teens with FASD reporting that they have experienced thoughts of suicide at some point. And this is compared to about 17% of the general population. Teens with FASD also have about 6 times the risk of making a serious suicide attempt, with about 13% reporting having made an attempt in the past year. And this is much higher than the general population, which is only about 2% report having made an attempt on their lives. And we see even higher rates in males with FASD. So they show actually almost 20 times the national average at about 29% reporting having made a suicide attempt. Substance use disorders are also higher in this population, with about 35 to 60% of those with prenatal alcohol exposure going on to develop a substance use problem themselves. And this is in comparison to about 8% of the general population. And there are a few reasons why we think this may be. It may be due to a biological vulnerability to substance use problems due to the prenatal exposure. It may be also an inherited trait. So if their parents had a problem with substance use disorders, that might have created an increased likelihood. We know that that's true. Individuals with FASD may also use substances to self-medicate some of these other problems. And individuals with FASD do tend to have difficulties with impulse control, making them more susceptible then to developing a substance use problem. So likely the explanation for these higher rates is complex, but those are some of the reasons we think that that might be true. And finally, individuals with FASD may be more prone to an impulsive type of aggression called reactive aggression, which we think of as occurring in response to events like real or perceived provocation, frustration, or threat, and is often accompanied by anger and or fear. And excuse me, this can often occur in response to provocation by peers or confrontation by adults. And as a result, teens with FASD may be more likely to be diagnosed with conduct disorders, and in general are seen to have more problems in interaction with law enforcement than their age-matched peers, particularly among males with FASD. So I'll now shift into discussion of some of the interventions that have been examined in the research, though unfortunately, the practical availability of some of these is not very widespread, particularly in rural areas. And a lot of this research is new, emerging, or has really small sample sizes. And so this is really a gap in the literature and in resources, interventions for teens and young adults. We talked earlier about school disruption being a risk for this group, and parental advocacy seems to be one of the variables associated with more positive outcomes. And coaching families, the Coaching Families program is one example of a family-based intervention that has been tested in youth with FASD up to age 23. And a few of the intervention areas included educating families about FASD, particularly in the teen years, how to access resources, and how to successfully advocate for the teen. And we know that in general, some of the recommended steps that parents can engage in to support their teens in school include things like sharing the FASD diagnosis and information with teachers and support staff in the schools, sharing your teens' strengths and challenges with teachers and support staff, ensuring that the school is aware of the other kind of care team members for your teen, providing additional resources to the teachers and staff, advocating for the teenagers as you know them best, doing your best to form those relationships with your teenagers, teachers, and support staff. And really, it may require some more involvement to ensure that learning needs are being met and their strengths are being developed. And then also recognizing that transition times for teens with FASD may be particularly challenging, and helping school staff and teachers understand that as well. So things like the move to high school, school holidays, return from school holidays or first day of new semester, and even changes in teachers or support staff. Another intervention that has targeted school performance problems in individuals with FASD, this one did have a cutoff of the age of 15, but it was called a computerized progressive attention training program. And for those who have viewed our earlier talks on behavioral regulation and math skills, there's some overlap with FAR and GoFAR skills. But the CPAT program, although it did have a small sample size, results showed improvements in sustained and selective attention, spatial and working memory, reading skills, and math fluency. Again, some overlap with the GoFAR program that we discussed in previous sessions of this series. This program that teaches metacognitive skills, this is another study that adapted an existing program called the ALERT program to the unique needs of teens. And this program included interventions like teaching teens to recognize and label regulation levels, learn sensory-based strategies to help get to a just right place to focus and learn. So if you see on this graph, that calm, alert arousal level is really what we're often aiming for. That is often thought to be the place where teens and children are able to best learn and perform. And then teaching to integrate these strategies into home and classroom and kind of real world settings. So some of the strategies, the sensory-based strategies that were used included things like coloring and drawing, listening to music, dancing, calisthenic exercises, yoga, playing cards, and sensory strategies using the 5 senses. So for example, eating a crunchy apple, orienting towards movement like the yoga or calisthenics, using sense of touch, vision, and listening strategies. So we talked earlier about the mental health comorbidities that occur for teens and just in general, individuals with FASD diagnoses. Generally, the thought is that intervention should lean more in the behavioral direction versus more of the cognitive interventions. When we're targeting some of the regulation difficulties and mental health comorbidities. But there is some evidence that shows that individuals with FASD can acquire skills and strategies through these more directive psychotherapeutic approaches, such as building mindfulness, distress tolerance skills, and coping skills via holistic mental health programs. So we've seen some success with integrated school-based programs, and these included multimodal methods of teaching, reading, role plays, videos, class meetings, visual scripts, social stories. And these interventions taught mental education and mental health literacy, so including things like knowledge and understanding related to mental health and mental illness. The goal often was to promote empathy and reduce stigma. Also includes skills for managing one's well-being, recognizing when oneself or others are struggling, fostering attitudes of respect, inclusivity, and non-judgment towards those struggling with mental health problems. And they also included what are called skills from dialectical behavior therapy, which is a well-established intervention. And this was originally developed for individuals with suicidal ideation and self-harm, but has then been adapted to those with developmental disabilities. So some of the interventions included interpersonal effectiveness skills like understanding and labeling, being able to ask for what is needed, assertiveness skills, sustaining positive relationships, being able to set boundaries with others and learn interpersonal strategies for fostering self-respect within relationships. Also emotion regulation skills like understanding and labeling emotions, knowing how nutrition, exercise, and sleep contribute to mental health. Mindfulness skills like self-soothing, non-judgmental ideas of self and others, and being responsive to both emotions and rational thought. And then finally, distress tolerance skills like teaching how acute distress affects emotions and reasoning, strategies for coping with acute distress. So we talked earlier about how self-harm can be an issue for teens with FASD. So a lot of the distress tolerance skills help teens learn alternative strategies when they're experiencing urges to engage in self-harm. So we discussed again earlier that adolescents with FASD are at increased risk for substance use disorders, and Project Step Up was designed for adolescents with FASD and their parents with the goal of preventing or reducing alcohol and substance use problems. The intervention content focuses on providing alcohol education, fostering skills to cope with stress, and teaching adaptive responses to alcohol-related social pressures. So there are teen and parent groups as part of Project Step Up. The teen content includes alcohol education, like normative feedback about peer alcohol use, what is a standard drink size, the amount of alcohol in common beverages, and discussion of how youth can stop or cut back on their alcohol use. It also teaches information about alcohol beliefs and expectancies, how to deal with stress, and teach adaptive coping without using alcohol. It teaches information about types of drinkers, negative consequences, so like binge drinking versus social drinking, negative consequences of drinking, resisting peer pressure, and alternative activities for replacing those situations where alcohol might be involved. It also teaches resistance and refusal skills and how to handle those situations if they go to a social gathering and alcohol is present. And the parent content includes things like impact of prenatal alcohol exposure on development, importance of structure and benefits of strong parent-teen relationships, monitoring how to handle common conflict scenarios around setting these limits, how to talk to your teen about alcohol, and then action steps, as well as parent self-care and resources. And the studies that have looked at Project Step Up have found that teens who've been through the program are more likely to cut down or abstain from drinking, teens engaged in less risky drinking, and had fewer negative consequences from their alcohol use. So the conduct problems that we discussed, and along with legal problems being common in this group, because of that, interventions for conduct problems are often, the ones that have been looked at have often been implemented in more residential settings. And aggression can be hard for youth to manage in less structured settings without avoidance, just total avoidance of the situation or more aggressive responses. And so they have found that a residential setting is more conducive to teaching some of these skills. But these interventions found the importance of structure, consistency, and protection from negative environmental factors that can interfere with the learning of these skills, as well as the importance of identifying factors or events that are likely to undermine performance and plan ahead for those factors. And then finally, safety and living independently is a really important area for teens. Teens with FASD may have a strong desire to connect socially, but they may also lack some social awareness skills related to safety. They may also have problems with regulation and impulsivity. So safety, again, is generally an important area of concern relevant to this developmental time period. This is also a time when adaptive and independent living skills become particularly important. And because of impulsivity and poor inhibition, teens with FASD may engage in unsafe behaviors unknowingly or unintentionally or with less forethought. And that's generally an issue for teens anyway, but even more so with teens with an FASD diagnosis. So areas of safety that may be important to target include phone and environmental safety, high-risk behavior warnings like targeting unsafe sex, alcohol and drug use, or strategies for if the teen gets irritable or upset in public. And then areas of safety related to independent living that may be a concern include things like household reminders for buying groceries, paying bills, cleaning the apartment, teaching the importance of having useful phone numbers, easily accessible like those of their advocates or police, hospital, or medical providers, transportation like routes, times, and costs, work and school schedules, as well as personal and household safety reminders like reminders to turn off appliances or lock doors. And one common suggestion for intervention is that safety cards are made for teens based on their unique intellectual abilities and unique safety related concerns. So this just shows a case example that's been adapted from some manuals from SAMHSA. This is a clinical vignette about a safety plan for a 21-year-old. So a counselor is meeting with a father of a 21-year-old who we'll call Jane. And the counselor is asking the father about his most significant concerns for his teen. And the father's concerns are, as he describes them, I'm really concerned that Jane won't be safe on her own out there in the real world. I get her desire to be on her own, and I know she's tough. We got through it when her mom and I divorced a few years back. She's turned 21 and she's feeling independent, but I know that she can't be totally independent. There's too many things that I help her with all the time. And I think my biggest concern is that others will take advantage of Jane, especially if she has a place of her own and people want to stay with her. She'll do things that she knows are wrong to fit in, like stealing or falling in with the wrong crowds. So this is just illustrates a common concern for parents and with teens who are growing up and maybe wanting more independence and independent living. So the key here is that we want to think about the definition of independence and safety is different for a person with FASD or other developmental disabilities. And it's often important to start by thinking about different advocates. So one way that a counselor might work with this parent is to identify advocates for Jane, people in her life that can be champions for her, basically. So that can include professionals or other family members, people who are really willing to help and be available to to Jane. And so that can include, in this case example, that ends up including an aunt, the father, a coach from their high school that they had a strong relationship with. And in addition to adding in some of those other safety interventions and safety cards that were created or listed in the previous slide. And this is an example of a safety or crisis plan that you then might develop, that a counselor and a parent might develop together. So you're identifying who the caregivers and legal guardians are, the counselor, some of identifying the main safety concerns for that person, any formal and informal supports like those advocates. It can also include people if they're involved in a faith-based community or organization. And then identify how specifically those support people can be available. So who that person is, what specific safety concern they can be available to help with, and then creating some steps for that crisis plan. So finally, vocational training is an important area to look at, and some of the common resources that are available for this population do relate to vocational training. We know that employment can be a protective factor against some of the adverse outcomes that we've talked about today, and can reduce poverty and dependency. And at the same time, research recognizes that individuals with FASD have a number of employment-related challenges. So individuals with FASD have some unique and diverse cognitive difficulties associated with their disability that can come up as inability to pay attention and or sit for long periods of time, impulsive behaviors, trouble remembering instructions, tiring easily from having to think and concentrate harder than other people might, as well as being slower to perform duties. And additionally, the lack of understanding among employers and coworkers regarding these cognitive and behavioral challenges can place increased pressure on the individual and may create some expectations that are unattainable or not feasible. So there aren't necessarily any programs that I'm aware of that were developed specifically for those with FASD, But some of the suggestions that for support that can be relevant include teaching interviewing skills, financial management, knowing when to ask for help, dealing with workplace routines and expectations, teaching awareness of issues related to safe work environments, and making sure to role play these skills. So that is the majority of my talk today. I did want to put up some of the resources that we are aware of. Again, unfortunately, this is a big gap area in resources, but I did include some of those that are available here. FASD United is a great resource, as well as some of these other links listed here. And I will, if anyone has any questions, you're welcome to email us. We would also love feedback. And I think Devin is going to include information for our contact information if anyone has any questions. There's a QR code as well as a link here if you have any feedback for us as well. But I'm happy to spend a little time right now if anyone has any questions.
Hello,
Yes.
This is Deborah. Hey, I missed the first like 20 minutes of it, and I just wondered if I had received notification about it on our Facebook group. And so will you be posting it there, or will I get it by email so that I could watch the first part?
Yes, absolutely. We recorded today's session, so we will be posting, I think maybe Devin, you can remind me, but I think we're going to post a link and then it'll be on YouTube, available on YouTube to view anytime.
That's correct. Great. Thank you.
Sure.